Hello, everyone. My name is Felicia Bazan, and today I'll be presenting on alcohol use disorder, one of the most prevalent and impactful forms of substance abuse in our society. Alcohol, or ethanol, is a depressant that affects the brain chemistry by increasing the GABA and decreasing glutamate, creating feelings of relaxation and lowered inhibition. Over time, these neurochemical changes lead to tolerance, dependence, and addiction. Alcohol has a long history from ancient rituals to the temperance movement, which led to the prohibition in 1920s. Once repealed, alcohol became widely available again, and since then it has remained the most frequently abused legal substance. Nearly 30 million Americans have alcohol use disorder. It causes around 140,000 deaths each year and costs the economy roughly $249 billion annually in healthcare, crime, and productivity loss. Alcohol misuse results from a mix of biological, psychological, and environmental influences. Genetics, trauma, and stress all increase vulnerability. Demographically, young adults in certain ethnic groups, like Native Americans, show a higher prevalence rate. In the short term, alcohol can make people feel relaxed, but it quickly impairs coordination and decision making. Overuse can lead to blackouts, injury, and even alcohol poisoning, which is life threatening. Long-term alcohol use affects nearly every system in the body. It damages the liver and heart, contributes to memory and cognitive decline, and increases the risk for depression and suicide. Clinically, we look for tremors, flushed skin, and poor coordination. Behavioral changes such as irritability or social withdrawals are common. CAGE and audit are survey tools used to help identify the severity of alcohol misuse. Alcohol poisoning can cause respiratory depression and death. It also frequently is used in suicide attempts, especially when combined with other depressants. Emergency care includes airway management and thiamine to prevent any neurological damage. As primary mental health care nurse practitioners, we rely on the DSM-5-TR criteria to inform our diagnosis and assess the severity of alcohol use disorder. This framework assists us in developing care plans and customizing interventions. The DSM-5-TR outlines 11 criteria, including craving, tolerance, and loss of control, and the severity is determined by the number of criteria fulfilled. It is crucial to identify comorbid psychiatric conditions such as depression and anxiety to ensure a comprehensive treatment approach. We also take a comprehensive approach combining pharmacologic and psychotherapeutic interventions. We assess readiness for change, prescribe appropriate medications, and provide education to empower recovery. Collaboration with other professionals and consistent follow-ups are also key in preventing relapse and supporting sustained sobriety. Pharmacological treatment begins with detoxification, using benzodiazepines to prevent seizures and thiamine to protect the brain. For long-term management, medication like naltrexone, acamprosate, and dilfusiran help prevent relapse. Non-medication interventions are crucial. Cognitive behavioral therapy, motivational interviewing, and peer support programs like Alcoholics Anonymous have proven successful in maintaining sobriety. Patient education empowers recovery. Emphasize that addiction is a medical condition, not a moral weakness. Encourage patients to stay medication compliant and replace drinking with positive coping habits. Referrals ensure patients receive holistic care, from addiction specialists to social services. Regular follow-ups allow providers to monitor liver functions, adherence, and risk for relapse. Conclusion: alcohol may be legal, but its misuse has devastating health and social effects. Recovery is possible through compassionate care, evidence-based treatment, and consistent follow-up. These are the references I've used to support our presentation. Thank you for listening.